Well, let's delve into what we know so far about COVID-19 and exactly how Australia is tracking. Professor Mary-Louise McLaws is an epidemiologist at UNSW and a member of the World Health Organization Advisory Panel for COVID-19. Thanks very much for your time today. I think it's fair to say even authorities are surprised seemingly at how well the COVID-19 curve, as we talk about, has been flattening in Australia so far. What do you put that down to in Australia?
We are very fortunate to be an island, so our authorities could shut down the borders very effectively, because one of our biggest risks for Australians were returning Australians from overseas and overseas business and tourism. So we've been able to do that. Then the next thing that really happened was Australians really got on board with social or otherwise termed physical distancing, which has made an enormous difference because the data show this. And of course, we know internationally that it's more transmissible potentially across the older group of patients. So we're doing very well.
The numbers we're seeing, we always assume there is a true number, that it's at least somewhat higher because of asymptomatic people. What's the worst case scenario there? How high could that number of asymptomatic people be out there in the community?
Yeah, look, you're right. I mean, at the moment, the data from the Commonwealth show that children under the age of 19 represent a very small number of cases. Now, this could be reality, that they could be less likely to have the virus, or it could be something like a hidden, silent spreaders through children, which overseas have suggested this is not the case. It's probably a little bit of maybe surveillance bias. We're doing a lot of testing, so you know the news just then told us how we've improved our testing, and there's over 380,000 tests done recently, which is a 20% increase in the last 12 days. But I'm not sure that they're including children as much as they could to ensure that they're not the silent drivers. But I suspect they're not. But I know some actuary results have suggested that we could have many, many more cases than we have. But I'm not as gloomy as that. I think that we may be able to find some hidden cases, but not as many as 20,000 that has been predicted. I think that's unrealistic.
It would also seem as though if there was somehow that big a number out there, we'd see it eventually, because the asymptomatic would eventually knock into people or see people who are symptomatic, and we'd see it showing up in presentations to hospitals. So it feels almost, on a logical sense, without being an epidemiologist myself, of course, that doesn't really seem logical.
Yes. I absolutely agree. It fails logic, because we would be seeing, even though we're under house lockdown, still you would be seeing adults getting it from their children, or children getting it from adults, or grandparents, or we'd have a bigger spread. We'd have more people going to hospital presenting themselves as ill. Now, I know that the government has really quite rightly called for people to be tested with mild symptoms now to flush them out. But I really think that the estimate is an overestimate in Australia, as we're travelling so well.
Amidst this schools debate, what you were saying before about children is very interesting. Obviously, there are unknowns about this. From what we do know here, and particularly overseas in higher incidence, it is that children, in particular younger school-age children, so children at primary school level, for example, are less likely to get the virus, and also, if they do have it, are less likely to pass it on either to other children or to adults in particular as well. Is that accurate?
Well, that's what we're seeing in Australia as well, that very few cases are school-age children, high school or even primary school. So the idea of loosening up some of the restrictions to include school children fall into that argument that they're not at risk. We do, of course, have a behavioural risk, though, and that is if schools are open, their parents dropping them off or picking them up need to understand that they can't enjoy the socialisation that they once used to, because they can be driving the spread. So we don't want them and we to do that. We don't want to
No.
go back to problems with, physical distancing.
No, well, it looks as though whatever we're doing in the next few months, if not longer, will involve social distancing, and we're all seemingly getting used to that. I know I am. Just on other children, we saw in New South Wales today a 7-week-old baby contracting the virus, seemingly in an okay condition. What do we know about very young children and babies and contracting coronavirus, their likelihood to, and the impact on them?
Yes. Look, this is a very new virus, and we're not seeing very many babies getting it. So the numbers and the assurance that I can give you is not really there to be able to say they have a better likelihood of survival. We can hope in Australia with our fantastic health system, and we really do have a fabulous healthcare system that's skilled up with NICUs, that's neonatal intensive care. This baby has all of the probabilities of surviving well.
Well, that's good news. Of course, that is one of the big unknowns with particularly
It is.
young children, as you mentioned. Just finally, you're obviously on the WHO Advisory Board, and I'm just clarifying that point, and based in Australia. I'm not saying you're responsible for the criticism that people are directing it at WHO, but people are wondering why they took the word of Chinese authorities and health officials at the start of this outbreak. What's your response to that criticism?
Look, people have to understand that during December and January in China, they always get severe community-acquired pneumonias. So, of course, all you can do is trust the numbers. And, of course, the local physicians and surveillance system were expecting pneumonias. So it took them a while to work out that it wasn't an ordinary, annual seasonal pneumonia. And then, of course, when WHO was invited in, they did, do a look-see, but they can only trust as much as they're given access to. And when we look at how well China then shared the virus with virologists to develop vaccines, and then ring-fenced Wuhan, which is an enormous challenge to do, and then cooperated, I think we have to give them some, honour for that. So it's easy to criticise both WHO and China, but in the midst of a pandemic, it's not really helpful, and it's also incredibly difficult to always get pandemics right. I mean, WHO has been criticised in the past for calling things too soon, like pandemic influenza, but when you don't see it actually causing a lot of deaths and cases, in fact, they called it well because there wasn't a lot of problems. But calling a pandemic doesn't stop us from acting locally.
No, and indeed, some countries, in particular Australia, did that. We're nearly out of time, but obviously the reports we've seen would be pretty concerning out of China, that doctors were silenced from coming forward, and monitoring of WeChat discussion boards and so on. I understand what you're saying, that now might not be the biggest focus on that, but that should be an important part of looking back on this virus and how it did get out there.
Look, when I was very privileged to look at the SARS outbreak in Beijing with the Beijing Health Bureau, they were very open to us analysing how well and what they could do in retrospect. And they learnt that, had they ring-fenced Beijing, maybe the history would have been a little different. So they are very open to understanding that they, can improve, and we can all improve. I mean, Australia finally closed its borders after we had an Italian Grand Prix team arrive, and yet Italy had a big problem. So each country can actually improve its response, and I think lessons learned at the end is more helpful than during.
Professor
the criticism.
McLaws, thanks for your time today.
It's a pleasure.